Hello, I'm Georgelina DeSanctis, Program Director for the Infectious Disease Fellowship at Spectrum Health, in partnership with Michigan State University College of Human Medicine in Grand Rapids, Michigan. The mission of Spectrum Health is to improve health, inspire hope, and save lives, and we stand by these core values. We have a unique program here at Spectrum Health. We have designed a very comprehensive and versatile schedule that is tailored to the fellow's career and educational interest. Fellows will have 9 blocks that can either be electives or research based on the fellow's particular interest. Our curriculum offers rotations in different areas such as microbiology, epidemiology, antibiotic stewardship, immunocompromised hosts, bone and joint, and pediatric ID. We work closely with our local health department with their TB STI clinics, and the fellows also have outpatient ID continuity clinic as well as HIV continuity clinic. Spectrum Health has a very robust transplant programs. These not only include adult stem cell transplant with CAR T-cell, but also an advanced heart failure program with LVAD transplant. Our lung transplant program has been ranked top 4 in the nation. We have a team of 10 faculty members with different interests and expertise that the fellows can choose as mentors for their research and scholarly activities. We participate in the Michigan Infectious Disease Society with a yearly fellows meeting, among other national and international ID meetings. We have a very engaged and supportive Office of Education who are available for assistance with your research projects. Our fellows were very involved in the hospital's response to the COVID-19 pandemic. They helped with infection control in the command center, reviewed patient therapeutics, and were instrumental in educating our team members throughout the hospital system, participating in various COVID-19 grand rounds. The overall goal at our program is to prepare fellows to function as a competent infectious disease physician in a variety of settings and to become the clinical and academic leaders of tomorrow. Thank you so much for your interest in our fellowship program and trusting us with your education.
Hi, I'm Vetrimurthy, one of the Infectious Disease Fellows here at Spectrum Health. What drew me to the program was its strong clinical base and diversity in patient population. You could see patients anywhere from solid organ transplant to bone marrow transplant to general ID. And I think antimicrobial stewardship is a robust program here, and it's a very strong aspect of the program. The faculty are very supportive, and you could in your second year choose your rotations to embrace your clinical career path after you graduate from the program, and I think that is a very positive aspect.
My name is Curtis Behenna. I'm a first-year infectious disease fellow here at Spectrum Health. I'm part of the first class of infectious disease fellows in this rapidly growing health system in West Michigan. I've enjoyed training at Spectrum for several reasons. I'd like to highlight our faculty. They're well-rounded, they're world-class. There's various subspecialties within this group, including our transplant faculty. We have travel medicine faculty that run a tuberculosis clinic at our local health department. They really focus on stewardship principles and infection control practices. Our local HIV clinic manages the care of over 1,200 HIV patients and boasts one of the highest viral suppression rates in the country. We have a high volume thoracic transplant service with tremendous exposure to immunocompromised hosts and opportunistic infections. It really is a well-balanced service. We have a highly dedicated faculty, especially our program director, and they're motivated to train highly effective and well-rounded providers. So I hope you'll consider joining our family.
Hi, my name is Habiba Hassouna, the Associate Program Director for the Infectious Disease Fellowship Program and Transplant Infectious Disease Lead Physician. As you know, transplant infectious disease is a rapidly growing subspecialty in the field of infectious disease, with more patients surviving and necessitating very specialized care. Our transplant infectious disease rotations consist of the bone marrow transplant rotation and the solid organ rotation. Our solid organ transplant is part of the Richard DeVos heart and lung transplant program that works hand in hand with an experienced team of cardiovascular, thoracic surgeons, pulmonologists, cardiologists, and transplant pharmacists and coordinators that take care of around 1,300 patients yearly, mainly serving thoracic organ transplant recipients, heart and lung, ventricular assist device recipients and candidates, who receive their organs and devices at our center or other local, national, or international centers. We also take care of abdominal solid organ recipients, liver, kidney, pancreas, who receive their organs at different centers and currently seeking local care. Our lung transplant program ranked among top 10 centers nationally, and we are proud of that. Our bone marrow rotation includes BMT recipients, CAR T-cell recipients, and oncology patients. Our goals for our fellows are to attain a breadth and depth of knowledge regarding the major infections, especially the opportunistic infections, including bacterial, fungal, viral, and mycobacterial organisms, to which the transplant recipients are susceptible to. We aim to provide familiarity with the different factors affecting the patient's overall state of immunosuppression. It also provides them with the opportunity to conduct research in this up-and-coming area. Overall, we are proud to provide our fellows with a specialized experience tailored to their needs and prepare them to take care of those complex patients on their own after graduation. Thank you for your interest in our fellowship program. Please do not hesitate to reach out with any questions.